Thank you very much. So we are going to discuss a little bit of rotator cuff repair plus the uses of a balloon. First of all, I want to thank you to Adele for this kind invitation. I'm from Ecuador. For people who knows nothing about Ecuador, is a little country in South America between Colombia and Peru. We are a country just in the middle of the world, so everybody is welcome wherever you want. I have no disclosure to communicate for this presentation. So remember, what is the balloon? The balloon is a biodegradable material that deflates after 3 months at least, and degrades fully after 1 year. Actually, there are some papers that show us that after 6 or 7 months, the balloon is degrade. So the main indication for the balloon was the irreparable cuff tear. But is there other possible indication? And the answer is yes. That was published in 2014 by the group of Laurent Lafosse in France, that maybe you could use the balloon to protect the massive reparable tears and to protect the tendon transfers. So why to use it in a reparable massive cuff tear? When you repair a massive reparable cuff tear, you have to wait until the rotator cuff heals in the great tuberosity, and then the rotator cuff could recenter the humeral head. But if you use the balloon, you could recenter the humeral head at the beginning. Besides that, when you repair a rotator cuff, you have to wait until the muscle belly gets stronger to could recenter the head. But if you put the balloon, the recenter is already done. Another thing that you have to see is when you perform a massive repair, sometimes you get a dog ear in your repair. And if you put a balloon above it, you could improve your attach of the tendon to the bone and avoid this kind of dog ear deformities. It is true that you could reattach better the rotator cuff. Well, with this paper published in 2018, the answer is yes. They actually tried to prove that the rotator cuff tear and repair were performed in 6 fresh frozen cadaveric shoulders and follow the insertion of a biodegradable subacromial spacer. And the conclusion is that actually they reduce the peak pressures and wider load distribution over the sensor during both passive abduction, adduction, and flexion and extension. Like you see in the figures at the bottom, the pressure is very, very good with the use of a balloon. And another thing that we have to think is that we have to protect the repair and maybe decrease the pain because the subacromial impingement. When you make a repair of the rotator cuff, most of the patient complains about pain at night. Why at night? Because at night you lose the gravity, the force of the gravity, and the upper limb tend to goes up, and that causes pain. If you put a balloon at the first time, you could help with the pain to your patient. And it's not my idea. This is reported by Laurent Lafosse, and in his series, he reported that in medium and large tears, the pain could be decreased with the use of a balloon. It was published in 2014, and the conclusion of his work is that the use of a balloon is effective in long-term pain reduction and improve arm mobility, that the insertion over a repair is similar to the insertion without a repair, and it may help in tendon healing. So whether we are discussing this in nowadays, look those publications. The first of all is 2020, and the other one is in 2022. And the conclusion of both papers are that the balloon is being considered not only in the setting of an irreparable tear, but as a protective implant in addition to primary rotator cuff repair. So nowadays we are talking about this topic in many papers around the globe. And this paper, I think, is one of the most important in the last 2 years. This paper was published in Italy by the group of Alessandro Castagna and Rafael Garofalo. They tried to evaluate the clinical outcomes and tendon integrity on MRI of chronic posterior superior rotator cuff treated with single row repair versus the same but with subacromial spacer as a protection. They included 32 patients with a mean follow-up of 27 months, and they used Sugaya classification in the MRI to look for the conclusions. And they conclude that in the group 2, they have an 81% of tendon integrity. That is very good result. So also they conclude that the clinical outcomes and pain scores were significantly improved without severe complications in the group that they use the balloon. Another field that we are thinking in use the balloon is when you perform a partial rotator cuff repair. And if you compare a partial rotator cuff repair with protective balloon versus those with not protective balloon, the conclusion is that in the group that you put a balloon goes better. This group have a subjective pain relief and improved shoulder function. And this paper also shows that the distance between the acromion and the greater tuberosity maintains over the time with the use of a balloon. So it's a field in developing. I think we are going to see many papers in the next years about the use of a balloon to protect our repairs. So see this clinical case. She is 55 years old, female. In her personal background, she had systemic lupus erythematosus from 30 years. She's taking corticosteroids. And in the orthopedic background, she had right shoulder dislocation in 2016 that was solved by a close reduction. Remember that all that kind of connective tissue diseases have a higher risk of rotator cuff tear. So this is the lady. She allowed me to show you her photographs. And look how different is she from 2016 to 2020. In the last 5 years, she have an important development of her illness. So if it happens to her body, think what happens with her rotator cuff. So at the physical examination, she have a shoulder very painful with so limited arcs of movements. The abduction was around 30 degrees and the forward flexion around 60 degrees. And the rotations was maintained. The acromiohumeral distance was good. And in the MRI, you could see rotator cuff tear, principally in the supraspinatus. And in the axial view, you could see there are some damage in the upper third of the subscapularis. And in this view, you could see a little bit of fat infiltration, principally in the supraspinatus. So it's a case where you can perform just a rotator cuff repair. But in the middle of her illness, we think that it's a better option to add a balloon. So we have a lady with 55 years old with right rotator cuff tear with a tear of supraspinatus on the subscapularis upper thigh with Gutalier 2, Lafosse 2, and Amada 1. And it's controversial if in her case we have to use a balloon, because she had a subscapularis upper third lesion. And actually, many people are talking about if you have a subscapularis lesion is a contraindication of the usage of a balloon, because when you put a balloon, because when you use a balloon, you will have this direction of the pressure of the humeral head just in front of the subscapularis, so maybe it will not heal. So in the surgery, we found long head of devices very, very damaged. So we decided to perform a tenotomy. Then we found the lesion of the subscapularis that was reattached with a single row repair. And then we continue with the reattachment of the supraspinatus tear in a double row fashion. This is our first row. And then we are performing the second row. After that, we put a balloon over the repair to protect our reparation. Like I said, most of the cases could be controversial, and you could ask if it's good or not to use it. But I think that, like in this case of the lady with so many problems, absolutely is a good option to use a balloon to protect your repair. Actually, this lady, after 3 months, she couldn't do rehab because she had some problems with her kidneys and gets in the hospital again. So after 3 months, she has no rehabilitation, but she is moving, and the range of movement are pretty good and also pain-free. So in conclusion, the basis and inception for a new and larger use of the subacromial spacer in a different setting had to be clinically investigated. Future studies will clarify this promising and potential benefit of the spacer as augmentation of arthroscopic rotator cuff repairs. This is my work team in Ecuador. Thank you very much.